as ever, we're in the midst of winter planning. We're putting down our initiatives on paper in a plan. Some good learning from last year and previous years, and some innovation. I think the thing we need to do to go further is really push ourselves on over the next few months. We've got a bit of a run in. Um, how robust are those plans? But admit, like when we do either major incident testing or actually clinical scenarios, what you do is you keep pushing people. You throw in new bits. I used to be used to be a paramedic educator for a part of my career. As you get students who are really excelling, what you do is you give them harder and harder. And I think what we need to do is really over the next few months test where can we push those boundaries, so that when it comes to reality in a few months' time, as we head into November and December, that we've already rehearsed some of this, and actually we're better at taking those risks together at a system level. We mentioned risk earlier in the podcast, and I think actually that for me is going to be critical. The situation is going to be dynamic. You've mentioned industrial action. Who knows what's going to happen with viral illness or and other things? How do we understand risk between us? And often I find in winter, I've worked lots of winters now in the NHS, we sort of reach a crisis. And we say we've done everything possible. Often we would say that's not true for either a major incident or in an individual clinical scenario. We would try more, and I think it's that we need to be putting into our plans, and maybe thinking the unthinkable in terms of what we might do, but actually so that we're ready and we're rehearsed for it more this winter than we have been maybe in previous winters.